this video, I'm going to talk about MAOIs as a class, just overall general information about MAOIs, why they're used. So MAOIs are used as for treatment-resistant depression or hard-to-treat depression. So you think of if someone has tried adequate doses, adequate trials of a couple SSRIs, SNRIs, mood stabilizers, augmenting possibly with an atypical antipsychotic. Looking at MAOIs as an option is a really good way to go, depending on the person and depending on the patient. So also can be used for atypical major depression, which is characterized by mood reactivity with like weight gain or like limb paralysis. A couple foods that you absolutely have to avoid are like highly aged artisanal cheese, high aged beef like you find it at really expensive restaurants, fish that hasn't been properly refrigerated or is past the expired date, which I don't think anybody would eat that anyway, homemade beer or wine. We know more about the food and the diet nowadays, and it's not as restrictive as it used to be. So your provider will give you kind of a printout of that, but it's kind of those things that aren't necessarily super common. So MAOIs, really good option to consider if you aren't having much of a response to other medications, taking into account that your provider knows that it's depression that's at play and not another diagnosis, looking at all the different variables. MAOI is definitely something to consider. So what MAOIs do is they irreversibly inhibit MAO, and so they covalently bind to and inactivate that enzyme. The patient is already on an SSRI or an SNRI, something with that serotonergic component. You think of like TCA, so the tricyclics that have the serotonin component, so like clomipramine. There's some other medicines in there that you definitely cannot take alongside the SSRIs, but not just, or the SNRIs, those other medications, but not just that, you need to wait at least 7 days. I do 14 days coming off of the SSRI, completely off of the SSRI, for example, like Alexapro, before starting an MAOI. So why we think that MAOIs are so effective is because of the broad effect that it has. So basically what it does is it prevents the breakdown of all three major monoamines. So you think of one of them being dopamine. So that's why we think that it's so effective. MAOIs are pretty underutilized in psychiatry, in my opinion, especially for treatment-resistant depression. You see, I've had patients come to me that have tried 7, 8, 9 different medications and have never tried an MAOI that are really good candidates for them. So something that can happen, some side effects can cause hypertension or hypotension, but also the things that keep providers away from prescribing MAOIs or patients from wanting to take them is because of the foods that you have to avoid.